Good afternoon. In about 1 hour, we'll have our first day of drive-through testing for COVID-19. This is an effort to ensure the safety of our hospitals and the public at large. We'll have some speakers later that will explain what that means. And with that, I would like to call Police Jury President Tony Guillory up.
Thank you, Mr. Grimion. The police jury would like to thank everyone that has worked very hard to make this great drive-through testing process. The public and private agencies are working together to serve the community with the resources that we have. We believe that this kind of testing will provide the best way to get tests to the people that need it the most. Thank you for all. Remember to stay at home and stay safe. This is not the time to be having crawfish balls. Stay home.
Thank you, Mr. Guillory. I'd like now to call up Lake Charles Mayor Nick Hunter.
Thank you, Dick. Good afternoon, everyone. I tell you, I'm very inspired by the power and the might and the collaboration and all of the groups that I see before me today. Southwest Louisiana is taking this seriously, and we realize that we've got to use resources efficiently, and we have to provide the necessary testing for our citizens. I don't know in the history of Calcasieu Parish if we have ever had a collaboration between the medical community, public, private partners like we are seeing today. Citizens of Southwest Louisiana and Calcasieu Parish should know that we are taking every precaution to make sure that this community is as safe as possible, and moving forward that we are going to get through this efficiently and calmly. And again, I am so proud of the collaboration and the efforts that you are seeing here today. This is a very efficient response. And again, to the citizens, we remind you that those numbers will increase as testing increases. That is mathematics. Stay calm, stay safe, stay home. Thank you.
Thank you, Mayor. I'd like to call now Lance Armitage with Avail.
Thank you, Mr. Grimion. First off, I would like to thank the Louisiana National Guard, the Office of Homeland Security and Emergency Preparedness, Memorial Hospital, Christus Hospital. Especially like to thank Liz Horman, who has been a valuable resource for all of us through this time. You know, it's the people who make up healthcare. It is who makes healthcare what it is. And it has been my honor to sit and watch the frontline staff and the administrators from all the hospitals come together to serve Southwest Louisiana in this time of need. I know that our community will stand together and persevere through this hard time. Thank you.
Next, Mr. Kevin Holland.
Thank you, Kevin Holland. I am the Chief Executive Officer of Christus Ochsner Health System here in Lake Charles. And I just wanted to communicate that there are truly a lot of heroes that are standing tall in the fight of this COVID-19 virus in our community. And this is a tremendous effort, as Lance said. A lot of people have come together to make this site possible today, and I want to echo Lance's comments. Thanks to everyone who has had a hand in that. And I just want to communicate to the community that all of the community hospitals in this region are standing tall, and all healthcare workers right now are truly heroes in this fight that we are engaged in right now. I'm very proud. I think all of the CEOs in the region would echo the fact that we're very proud of all of the community resources that we have and the great hospitals that represent this region. We are complying with the governor's mandate to restrict elective or non-urgent procedures right now, but I do want to share and make sure that the community is aware that we are prepared for where we are today, and that we are all aggressively preparing for what we may face in the coming weeks. And we are working together very collaboratively in ways that are unprecedented. And I just want everyone to know that all the community hospitals are open for business, and we continue to take care of all the emergent and urgent needs in our community. Our emergency rooms are open and fully operational, and we're going to continue to stand tall in this fight in the days ahead. And again, I want to thank everyone, all the elected officials, the military, everyone who has come together to make this happen. Truly all heroes, and we're going to continue to press ahead. And I want to echo everyone's comments. We will get through this. We will get through this, and we're going to continue doing our part to effectively get through this and back with our daily lives. So thank you again.
We'd now like to bring up Dr. Holland from Memorial Hospital Group.
Good afternoon. This is what happens when communities come together, when we have public and private agencies come together with a shared vision for the collective benefit of our community. This is so important, and I can't stress enough that we do have a window of opportunity to make a huge difference in our community. With regards to the healthcare workers, I wanted to let you know on behalf of them, they are aware of the outpouring of support, the tremendous amount of materials, the equipment, especially masks that have been donated by both private and public agencies. They're very appreciative. And I'm talking about healthcare workers, including first responders, lab technicians, med techs, nurses, doctors. Everybody is appreciative. I want to echo that we do have ongoing site testing in other locations. We have a lot of partnership in the community. West Calcasieu Cameron Hospital has their testing on site for members of the community that may not be able to make it across the river. SWLA has their site that is going to be ongoing testing. So I certainly want to recognize their contribution to this effort as good partners. This testing center, again, the criteria were scrutinized by infectious disease consultants and other physicians on the front line. And it was determined to try to identify a high-risk population that, if infected, are going to have worse outcomes than others. So that was our focus. And of course, it starts with age, an age greater than 60. And then it goes down into people with comorbid conditions, other coexisting medical conditions such as heart, lung disease, cancer, immunosuppressing medications. And then also includes symptomatology in that. So the criteria has basically been, we also looked at what other communities were using to help us with these criteria. I think we need to also recognize the most important member of the team, and that's the public. That's our citizens in Allen Parish, in Beauregard, Cameron and Calcasieu, and Jeff Davis. Y'all are the most important members of the team, and this is the time that we need you to do your job. We are all committed, and I know y'all have been committed to do your job. This is not the time to relax, to get complacent. This is time to redouble those efforts of practicing our social distancing, cough etiquette, hand hygiene, and wiping down these common touch surfaces. I'm very encouraged. I've seen the efforts out there, and I'm very optimistic about the future. I think we would be foolish to think that we're invulnerable to what is happening in other areas of the state, like Southeast Louisiana. And everything we do today, and what we have been doing over the last 5 to 7 days, even before that, will make an impact. So I'm very, very optimistic that we are going to get through this. And when we look through the rearview mirror at this and think about all of our freedoms and liberties, I think all of us are going to have a little bit different perspective. So again, thanks for everybody for what they're doing. This is truly a team effort. And stay safe, stay home, and stay healthy. And oh, by the way, it's a beautiful day. If you want to get out in your yard, absolutely do that. So thank y'all very much for your time and attention this afternoon.
Thank you, Dr. Jordan. Now I'd like to call up Dr. John VanHoose with the pathology laboratory. And I'd just like to say, I've been on various planning committees with Dr. VanHoose for over 20 years, and I can tell you he's very involved in the planning issues. Now that it's come time to execute, he's put his full staff available to us for whatever we might need. So Dr. VanHoose, come on up.
Thank you very much. It's been an honor and a privilege to be involved with this process. There are so many hardworking people here trying to get us through this healthcare crisis, so we appreciate our opportunity to be involved. The pathology laboratory has been providing support for Southwest Louisiana for over 60 years, and so this just fits into our values and part of what we do. Also, at this stage of this healthcare situation, testing is extremely important, and so it's our role to help facilitate getting those results back to providers. Let me talk for a moment about testing. A lot of you may be somewhat confused over the concepts between sample collection and actual testing. And so let me be clear that what's occurring here at this site and at all the sites across the city are actually sample collection in order to be tested. That testing currently is being sent to outside laboratories. Initially, it started with the CDC, and they were the only site that was accepting testing. They quickly became overrun with samples. As testing kits, reagents became more available, those were distributed out to the states, and so the states started testing, and then they began to be overwhelmed, and then those reagents were made available to the national laboratories, and that's where it sits right now. And so all of our testing from the samples actually goes out to national laboratories. Now, as the manufacture and distribution of these reagents have improved and increased, then there are more testing sites that are coming online. And so we are working every day to try to get those reagents here so we can begin testing locally. So that's an ongoing effort. Lastly, what I want to say is that I really appreciate my staff who has given so much in terms of leadership and logistical support. And I want to re-emphasize that the efforts that you are seeing here today are truly a cooperative effort that involves the hospitals, as was mentioned, Lake Charles Memorial Hospital, the Christus Organization, West Calcasieu Cameron, which already opened up a drive-through testing site, as well as local clinicians, including J. Mark with Lake Charles Urgent Care, and other providers who are here. The OEP has been instrumental, as well as the National Guard, and then also, not to leave out, Southwest Louisiana Health Center, who's also facilitating testing. So we appreciate the efforts of everyone. Thank you.
Is it okay to ask questions at this point?
We'll have a question to answer at the end, please.
Okay.
One more speaker. Without Louisiana National Guard, we couldn't do this. I'm going to call up Lieutenant Colonel Primack to make a few comments for National Guard. And just understand, these guys that you see in uniform here, most of them are your friends and neighbors from right here in Southwest Louisiana, so they're doing a tremendous job. Colonel Primack.
Thank you, sir. We're proud to be here as part of the team. At the direction of the governor, the Louisiana National Guard is providing trained and ready soldiers and airmen to support our local and civil authorities during their pandemic response activities. Our first and foremost priorities are safeguarding the population, saving lives, and protecting critical infrastructure. And like Mr. Grimion just said, many of our soldiers are from right here in this community. They live here, they work here, so they are your neighbors and your friends. The National Guard is called to duty, our guardsmen, to support many missions across the state, including current operations, medical support as we're doing here. We have several other testing sites up and running across the state, and as those keep evolving, we'll keep shifting resources to support those missions. We're also doing some shelter security. We're supporting our parish EOCs with liaison officers, and we're always looking for the next mission, what's coming next, so we're ready to bring on more soldiers as those missions dictate. But we're proud to be part of the team, and we are here, just to echo it, we're here in support of our local and civil authorities here. Thank you.
Thank you, Colonel. Now we'd like to get any questions and answers that you might have.
I was wondering if somebody could explain the turnaround on the testing
Okay, I think this will be for Dr. VanHoose. The question is, what is the turnaround time on the testing? Is it 3 days or 4 days? And then once a positive test comes in, who would be notified of the positive result? Is that your question, Teresa?
Yeah, more or less. When will the people tested find out?
The initial test turnaround time was about 3 days, but as more and more tests have come in and overwhelmed the system, that's pushed that turnaround time back quite significantly, a lot of times in excess of a week now. But what will happen will be that the national labs are extending the testing to other facilities that they have as they get more reagents, and so that will temporarily cause the turnaround time to decrease again. So for instance, this week, we were sending specimens that went to California, and it was taking over a week. Now, our specimens are going to Dallas, and that's about 3 days for that turnaround time. But at some point, they're going to become overwhelmed as well, but there will be other testing sites, and again, we hope to get it open local here also, which would assist with the turnaround time.
At the pathology lab?
Yes, ma'am.
Okay. I was wondering if somebody would want to go over what the people coming here need to know so that they're not turned away.
I don't have the exact list. Could someone bring me that list? The list of the requirements for the testing. It starts with having a fever. Paul, if you could just come up and read those. Do you have another question, Teresa?
As well as how you want the people to behave. In other words, I understand you don't want them to roll down the window and
Right.
start asking a bunch of questions.
Yes. When the person gets here, they will be greeted by some National Guard troops at the road, and they'll be directed on where to go for the testing. And here's what they need. We need a name, we need their date of birth, driver's license number, and then the first question will be, do you have a fever? If it's over 104, then you'll proceed for testing. If it's less than 104, you will get into a line and leave the area.
Do you mean 100.4?
100.4, I'm sorry, 100.4. Other symptoms, shortness of breath, and these are symptoms that would be used to evaluate whether the person will be tested. Shortness of breath, sore throat, cough, or if none of those are present, you probably will not meet the criteria for testing. Other high-risk considerations, age 60 years or older, prior lung disease such as COPD, asthma, and chronic bronchitis. Heart disease not including hypertension or high blood pressure. Diabetes, compromised immune system such as HIV, cancer, and chemo treatment within the last 2 years, dialysis patients, or others that are on a medication that's currently suppress your immune system. If the patient meets all of these test criteria, questions, then they will proceed for testing. And then Dr. VanHoose is explained the process after the sample is collected.
And if they don't meet those criteria?
They'll need to go back and talk to their physician.
Okay. And I was wondering if maybe the National Guard wanted to explain whether they're engaged in any other mission other than helping with the testing.
Carl, the question is the National Guard locally, and you're asking locally, are you involved in any other missions currently besides this one?
Yes, ma'am. Locally, this is the only mission we're supporting in Calcasieu Parish right now. We're going to be supporting this site with traffic control and the screening process and then the actual testing of that process. Other locations across the state, there are some shelters set up in Jefferson Parish. There's one set up in just north of Ville Platte at Chico State Park that we're providing some security to those shelter sites where people that are identified as infected can go if they have high-risk people in their families. So, we provide the security for those sites in support of the local authorities there as well.
Is there any need for any shelters here at this point or extra hospital space?
Ma'am, I'll defer back to the DHH folks, the LDH folks for that one. The other mission we're doing across the state is we're supporting food banks, helping with those resources and getting food bank distribution out to the communities.
Teresa, I can tell you that the state has teams out evaluating different locations. We have heard of none here. The shelter, currently the isolation shelter site for this region would be at Chico State Park. That's for Region 4, which is Lafayette, Region 5, Lake Charles, and Region 6 in Alexandria.
Okay, did you want to go over the testing dates? I understand today.
The testing dates will be today from 1 to 3, and they will resume again on Tuesday at 8:30. Is that correct? 9 o'clock until 3:30? 9 o'clock until 3:30. That would be Monday, Tuesday, Tuesday, Wednesday, and Thursday of next week, and on into the next week. Should have the same schedule. We'll advise next week what the following week's schedule will be. Any other questions? I'd like to say one thing just as a follow-up about what the National Guard is doing. These Guard guys have been here for over a week, and we've had a lot of questions, of course, on social media. Why is the National Guard being called out? What people don't realize is when they're called to go to war, like to Iraq or Afghanistan, that's what they do. But when they're in the United States, this is what they do. They have a humanitarian mission. There should be no surprise from people. We've had plenty of help from them with hurricanes and other natural disasters. So I just wanted to clear that up. Anyone else with a question or any other alibis? Does anyone need to make any further comments? Okay, seeing none, we need to hurry and get converted for actual testing here. So thank you for coming.